Hello again. I'm going to go ahead and start where I left off. Oops. Right here with performance measures. And performance measures are used to examine cost and quality of care, which is what we've been talking about. And they're identified for hospitals and long-term care facilities and home care. And the first one is called benchmarking. Benchmarking is a quality measure, sets a goal. Example, like wait time in the emergency room. So they set goals in that way. The next one is patient satisfaction. And patient satisfaction focuses on what patients value, and it matters. It takes place after the healthcare experience, which could be a disadvantage, but that's when they fill that out. It's an important core outcome measure that Joint Commission needs. And there's three parts that I want to talk about as far as patient satisfaction. Number one, patient satisfaction instruments. So, for example, the instruments that are used are typically from companies that provide these patient satisfaction instruments for healthcare facilities, like, for example, Gallup and Press Ganey Associates are probably some that you're familiar with. And generally, the hospital pays these companies to collect and tabulate data for them in regard to their patient satisfaction surveys. Number two, patient and provider expectations. So these must be clearly identified for an adequate assessment. So what are the expectations? And number three, staff evaluations. And these may be directly linked to satisfaction results. Results from these surveys can improve measures of quality of care. So hopefully once the measures come back, think something can change. They can manage complaints. So if there's complaints from patients, can evaluate and provide maybe bonuses for floors, so they can be helpful to evaluate the staff as far as how well they were perceived by the patient, which could hopefully lead to something positive. Um, and the other thing I want to say, I'm sorry I drew a blank, but it can meet accreditation standards. So I was trying to think. So certainly patient satisfactions and surveys are necessary to meet accreditation standards. The next one, performance measurement and patient value. Do performance measurements reflect what patients value? That's important, or they pretty much are useless. Shifting emphasis from individual to population. So the other thing that needs to be taken into account is that parents of young children are going to have like a different focus than maybe an older person with chronic diseases. So administrators need to focus on what the patients want and what they value, and to the population that they're looking at. If not, like I said, the statistics become useless. Balanced scorecard, best approach to performance measurement. So using the balanced scorecard to determine whether the change is actually leading to any kind of improvement. So what does the scorecard, and there's charts that are run to determine if there's been any changes and if these areas that we're looking at actually show improvement. And another measurement related to care provided is utilization review. And its primary purpose is to ensure that the appropriate use of available resources and available services are used. And this typically is integrated into case management. So case managers are really responsible or have a big role in making sure that they're using appropriate available resources and services for these patients, like physical therapy, home health, clinical pharmacy, just a little bit more on case management. I know this is a little bit wordy, but it involves a comprehensive and systematic approach to provide quality care. The purpose of case management: mobilize, monitor, and control resources that the patient uses, during a course of illness while balancing quality and cost. Always want to try to balance these. Case management is defined as a healthcare process in which a professional helps a patient develop a plan that coordinates and integrates the support services that the patient needs to optimize their healthcare and psychosocial possible goals and outcomes. The case management process helps the patient and their family navigate through a complicated set of services and supports, we know that are available within their benefit plan, their organization or institution, and their community. So it's hard to navigate through all these services, and that's what case managers do. Concerning cost-effective outcome analysis, Hooden et al. Did a study and found that approximately 10% of patients account for approximately 70% of all healthcare expenditures. Interesting. We probably see that in our practices. Statistics show that 5% of emergency department patient accounts for 30 to 50% of emergency department visits. It's pretty amazing. And these high utilizing patients, they just are high utilizers, may unsuccessfully attempt to meet their healthcare and related needs on their own, which is often ineffective and characterized by overutilization of expensive or underutilization and a coordinated effective healthcare and social services. So just something that is what case management sees regularly. The next ones we're going to talk about is the Leapfrog group. Some of you may have heard of this. And its primary focus is to improve and implement best practices. And they give a composite score made up of 22 evidence-based measures regarding patient safety, like medical errors, falls, et cetera, et cetera. And they give this score to improve and implement best practices. Magnet recognition program is a designation of a magnet facility, and when a hospital is designated as a magnet facility, that has become an indicator of quality. We think quality when we see a magnet hospital. It's voluntary, so not all of the hospitals have to participate, and it includes an evaluation of nursing excellence. So this is nursing excellence here, and innovation in nursing practice. And so a lot of you are familiar with that. The National Database of Nursing Quality Indicators was developed to demonstrate how nursing care promotes quality and patient safety. Again, there are data that includes hospital-acquired infections, hospital-acquired pressure ulcers, falls, those types of things, and how nursing care promotes quality. So nursing quality indicators and patient safety. Okay, so this next one here, we're talking about quality assurance, quality improvement, continuous process improvement, a management process of monitoring, evaluating, continuous review, and improving the quality in providing healthcare. Quality assurance. We talk about quality assurance. It's a process for evaluating the care of patients using established standards of care to ensure quality. Quality can be improved by continually monitoring structure, process, and outcome standards. So just continually monitoring them. Used to assess, monitor, and improve care that we provide to patients. And you know as well as I do, it's just an ongoing process. The first step in quality improvement project is to identify an issue that will be addressed. We have to identify what the issue it will be addressed is. Then we select an implementation model, monitor data, then implement the change. And that's pretty basically how quality improvement project will proceed. Quality and Safety Education of Nurses, which is called QSEN initiative. It's an initiative aimed at providing future nurses with knowledge. I should get this highlighter. Knowledge, skills, and attitude necessary to ensure continuous improvement in quality and safety of the respective healthcare systems. Okay, so this is to provide nurses with knowledge and skills and attitude. Identifies funds and promotes education. So this is promoting education. This is a model used to promote education. And there's 6 key competencies. It's patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, which we've been talking about, safety, which we've been talking about, and informatics. So these are all addressed. So this is something that's used when you go back and you get your bachelor's degree or master's degree. Root cause analysis is a tool for identifying prevention strategies to ensure safety. A process that is part of the effort to build a culture of safety and to move beyond the culture of blame. Okay, this is what we don't want to be doing. We want to promote safety and not fear and blame. Root cause analysis is the process of discovering the root cause of problems. What is the cause? What's the root cause of the problem? So we can identify appropriate solutions, not blame. And root cause analysis assumes that it is much more effective to systematically prevent and solve for underlying issues rather than just treating ad hoc symptoms and putting out fires and reacting, and spend time preventing and solving for underlying issues and preventing them before they happen. It's a problem-solving process. In the case of a medical error, this variation in performance may result in a sentinel event. That's something else you'll need to know. For accreditation purposes, the Joint Commission requires that healthcare institutions have a comprehensive process for systematically analyzing sentinel events. And you probably know that from your workplace. The root cause analysis process is one of the most commonly utilized tools for this process. The ultimate purpose of Joint Commission's accreditation process is to enhance quality of care and patient safety. Each requirement or standard, the survey process, the sentinel event policy, and other Joint Commission initiatives are designed to help organizations reduce variation, reduce risk, and improve quality. Healthcare organizations should have an integrated approach to patient safety so that high levels of safe patient care can be provided for every patient in every care and service. So this is a big goal. Example, the Joint Commission created a universal protocol that was designed to improve safety and reduce the occurrence of procedural errors. This protocol requires organizations to perform a timeout. So there were errors in procedures. So now they do a timeout for all procedures, which requires a team to confirm the patient's identity, let it make sure everybody knows that it's the right person. The procedure for what the patient was consented. This is what you're here for. You're getting a colonoscopy. You're getting the surgery. And the site where the procedure will be performed. You're getting surgery on your right foot. You're getting surgery on your right hand, okay? Where it will be performed before the procedure can begin, okay? So this is something that Joint Commission created, which I'm sure you're all familiar with and you've been involved in that. It's an example. A sentinel event is an unexpected occurrences involving death or serious physical injury or the risk thereof, meaning the risk of death or the risk of serious physical injury. Serious injury specifically includes death, permanent harm, severe temporary harm, among other things. Such events are called sentinel because they signal the need for immediate investigation and response. This is immediate. Oops, sorry. The term sentinel event and medical error are not synonymous. In response to a sentinel event, clinicians and institutions are expected to conduct a root cause analysis. So when there is a sentinel event, a root cause analysis needs to occur. What is an appropriate response to a sentinel event? An appropriate response to a sentinel event may include the following: stabilize the patient, disclose the event to the patient and family. We don't want to keep it from them. Provide support for the family and the staff who's involved, whether it's a medical error, if it's a blood reaction because of the wrong blood product that was given, because it was of a fall, a patient suicide, and there's just multiple things. Notification to hospital leadership, so we should have to let somebody know. An immediate investigation occurs for a sentinel event. Comprehensive systematic review what the system was and what happened, where did we go wrong. Root cause analysis is done for identifying the cause and contributing factors. Strong corrective actions to eliminate the root cause and prevent similar future events. So, oops, I'm sorry. What did I do? I know what I did. I did this. So strong corrective actions. So for example, a patient in the psych unit committed suicide with a razor blade. Strong corrective actions would be to eliminate a cause. There are no more razors with razor blades on that floor. Establish a timeline for the implementation of corrective actions. So something reasonable when this corrective action is going to be, when it's going to occur. And overall, we'll have system improvement. All right, I think that's it. Thank you.